Professor Dr. Sadia Ahsin, and I'm working at Foundation University School of Health Sciences as the head of department, and I'm a PI of this project 3041 outreach model to promote basic life support. Now, sudden cardiac arrest can happen to anyone, anywhere and any time, and it can lead to mortality. It is about 15% mortality globally because of sudden cardiac arrest, and if there is no intervention done within minutes, it can almost always lead to death. Basic life support, including cardiopulmonary resuscitation or CPR within 3 to 5 minutes and defibrillation with an automated external defibrillator provided by bystanders, can 2 to 4 times increase the chance of survival in out of hospital sudden cardiac arrest victims. The survival rate, not only just increase the survival rate, but it can improve the number of trainers in CPR. So if we have more trainers for CPR, that means we have more chances of saving lives. So at educational institutes, if we have trained staff, students and faculty, we can assume that these people can train others at home or in their surroundings, and they can increase the number of trainers and they can increase the chances of survival too. So at Foundation University, we planned this study because there is always a challenge of having trainers. We don't have enough trainers. So if we have enough number of trainers, we don't have the equipment, which is special community-based equipment, community-based training equipment, which is includes the mannequins and it includes the automated defibrillators. If we don't have those, so we would not be able to do the training. So we planned this study in collaboration with HEC. We asked for the equipment, and we had the manpower in the form of our own students. So we collaborated with HEC and we got this equipment for training the community with the notion that if we train the community in the educational institutes, we could train many people in the community because we are training educated lot. So this is how we got the equipment and the trainers, which is our own. We educated about more than 15 institutes of Rawalpindi and Islamabad, and this study was carried out in 3 phases. In the first phase, we were training ourselves, our own students, and in the second phase, there was education of the trainers, that is at the educational institutes, so that we could have more trainers. And in the third phase, we analyzed and we saw the outcome, what happened and what was the outcome, effect, impact on our own students as well as on the community. So that's what we did. 120 volunteer medical students were recruited after an initial assessment of their BLS knowledge and skills by a qualified BLS trainer. Teaching and training of student teams and leaders for the role of community trainers was done. BLS protocol, questionnaires and brochures were prepared for community participants and were also translated in Urdu language. So we approached different educational institutes and we planned workshops for their faculty, staff and students. They were hands-on workshops. Trainer teams visited 15 educational institutes at different times and provided hands-on training to faculty, students and staff members. They also collected questionnaires which reflected their pre- and post-workshop knowledge. Overall, the impact of this project was seen, and we trained almost more than 1,000 people with hands-on training, and we also saw the impact on the students through questionnaires, and they felt that their confidence level had markedly boomed and their own technical skills had improved.
Assalamualaikum. I am Dr. Salman Tahir, a resident surgeon in Fauji Foundation Hospital, Rawalpindi. I would just like to share a little story. This was back when I was in third year MBBS, and I was at the Jummah prayer when I saw a lot of men gathered around an old man who had certainly collapsed. Luckily, I was there at the moment, and I saw that the old man required CPR. And well, I started off with the CPR, and after 10 minutes of cardiopulmonary resuscitation, we were able to revive the old man. And I am just sharing this story to thank the Higher Education Commission and my medical college, Foundation University School of Health Sciences, for not only allowing me to attain this skill, but also giving me the confidence to actually be of help when such an incident occurs. So thank you very much again, HEC and my beloved medical college. Thank you.
In addition to having improvement in the knowledge and skills of our own students, there was also other impact of this project, that we have now trained American Heart Association qualified faculty members who are regularly training College of Physicians and Surgeons trainees at Islamabad, and they are regularly taking their workshops. Also, we have BLS workshops now regularly being conducted as part of our curriculum, and this project actually also received a second prize at an international conference, and it was very much appreciated because of the impact it has created on the community. I'm highly thankful to my own university and Higher Education Commission of Pakistan for providing me with this opportunity to serve with my humble knowledge and to serve the community.